everybody. This is Rotary and Hasif Chaudhary, Joint Secretary of Bazar Shaikot. I am here to welcome you to our third Rotary Area Focus Talk, that is RAFT 3, Phase 3, under the Rotary Area Focus Disease Prevention and Treatment and Maternal and Child Health. Today's talk is going to focus on Healthy Kid, Better Learner, a project of Pediatric Education Development Society International, PEDSI. This is PEDSI from USA, along with our relevant organization activities. Now, our Honorable Past President and Rotary Foundation Cadre Advisor, Mr. Jalaluddin Mohammad Shoaib will chair our event. Now, I request him to deliver his welcome speech. Mr. Jalaluddin Mohammad Shoaib.
Assalamu alaikum. So we are from good evening, and for those who are from USA is a good morning. আমি বাংলায় বলি যে বোধহয় সবাই আমরা বাংলায় আছি, একজন মাত্র ফেবিয়ান উনি হয়তো বুঝবেন না। আমরা আজকের আলোচনাটা আমরা এইভাবে প্রতি সপ্তাহে এই আলোচনাগুলো করছি এবং আমাদের বিভিন্ন অতিথি বক্তারা আমাদের কাছে বিভিন্ন বিষয় নিয়ে আলোচনা করেন। আজকের আলোচনায় যারা যোগ দেবেন আমেরিকা থেকেই, এবং আলোচ্য বিষয়টা হচ্ছে যে বাচ্চাদের শিক্ষা সাথে তাদের বিষয়। আমি ব্যক্তিগতভাবে এই লাইনে খুব একটা স্কিল দক্ষ নই, তবু আমি যেটা মনে করি সেটা হচ্ছে যে বাচ্চাদেরকে যদি সুস্থ বাচ্চা যদি হয় তাহলে তাদেরকে প্রশিক্ষিত করা সহজ, এতটুকু আমি বুঝছি। আপনারা যারা এই বিষয়ে আমাদের কাছে সাথে আলোচনা করবেন, আমরা আশা করি আমরা সবাই এগুলো এনজয় করব। প্যান্ডেমিক সিচুয়েশনে যদিও একটা কথা বলা যে আমরা কেউ কোথাও বেরোচ্ছি না, আমরা কোথাও কারোর সাথে যোগাযোগ করতে পারছি না, কিন্তু আমার ধারণা গত 6 মাসে বাংলাদেশে থেকে আমরা বিভিন্ন অর্গানাইজেশনের মধ্যে দেখেছি যে যাদের সাথে কখনোই আমাদের যোগাযোগ হতো না তাদের সাথে আমাদের যোগাযোগ হচ্ছে, এবং সেই যোগাযোগটা কিন্তু খুবই এফেক্টিভ এবং এটা কার্যকরভাবে আমরা দেখেছি কাজগুলো, যোগাযোগটা আমরা কন্টিনিউ করতে পারছি। তো সেই ক্ষেত্রে আপনারা যারা এই আমেরিকা থেকে আজকে জয়েন করেছেন, আপনাদেরকে আমরা একদিন কক্সবাজারে দেখবো। যদিও লুইস বললো যে তাদের সাথে দেখা হবে, কিন্তু আমরা জানি না কবে কিভাবে দেখা হবে। বাংলাদেশেও ঠিক একইভাবে আমরা বিভিন্ন জায়গায় এইভাবে মিটিং বা ভার্চুয়াল মিটিং করছি, কোনো ক্ষেত্রে হয়তো ফিজিক্যাল মিটিংও করা হচ্ছে, কিন্তু তারপরেও সবার নিরাপত্তাও আমাদের জন্য একটা গ্রেট কোয়েশ্চেন। আপনারা যারা আসছেন সবাই নিরাপদে থাকবেন, ভালো থাকবেন, এবং আপনাদের আলোচনাগুলো আমরা উপভোগ করব আশা করছি। আর এই ক্ষেত্রে আমি পিডিজি বাহাত ভাইকে অভিনন্দন জানাচ্ছি, উনি আসছেন, এবং আমি দেখছি আমাদের রেসিডেন্ট গভর্নর ও জয়েন করেছেন। আপনাকে আমরা অভিনন্দন জানাচ্ছি আজকের আলোচনায়। আমি এই বলে আমার বক্তব্য শেষ করছি এবং আশা করছি আমরা আপনাদের আলোচনাটা উপভোগ করব। আপনাদের সবাইকে ধন্যবাদ।
ধন্যবাদ। Now I request our Rotarian Rubai Chaudhary to present a brief introduction of PEDSI. Rotarian Rubai Chaudhary.
PEDSI Global Health is a voluntary non-profit organization formed in USA, comprised of physicians and nurses who are committed to promoting medical educational activities in USA and developing countries. Its members include pediatric emergency medicine specialists, physicians, and nurses. They have 20 years of considerable experience in organizing top quality courses. It has a core of qualified basic life support (BLS), pediatric advanced life support (PALS), Advanced Pediatric Life Support APLS, and Neonatal Resuscitation Program NRP instructors as volunteers. It has established American Heart Association AHA International Training Center in Bangladesh to train experienced Bangladeshi physicians to offer essential pediatric life-saving courses in all parts of Bangladesh. It is involved with American Academy of Pediatrics AAP to promote global health initiatives for improvement of maternal and child health. Dr. Maksud Choudhury, President and founding member of PEDSI, received his MBBS from Chittagong Medical College. He completed his DCH and MRCP degrees from UK and completed his residency in pediatrics in New York. He is currently Associate Professor of Pediatrics at St. George University and an attending physician at Coney Island Hospital, New York, where he has received multiple teaching awards. He is the past president of Bangladesh Medical Association of North America, BMANA, from which he organized many conferences and cultural events. He is involved with multiple charitable organizations in USA and Bangladesh. Dr. Wasim Hafiz, medical director and founding member of PEDSI, received his MBBS from Dhaka Medical College. He completed training in pediatrics at Dhaka Shishu Hospital and in New York. Since 1990, Dr. Hafiz has been working as an attending physician in pediatric emergency medicine at the Children's Hospital and at Montefiore, CHAM. He is an associate professor of pediatrics at Albert Einstein College of Medicine, NY. He was the medical director of Pediatric Advanced Life Support, APLS, at the Montefiore Life Support Training Center. He has published research articles in medical journals and written textbook chapters on various topics. Apart from volunteering in PEDSI, he has been to medical missions to Haiti and teaching programs in Zimbabwe, Philippines, and Bangladesh. I request Dr. Choudhury and Dr. Hafiz to introduce their revered colleagues and their presentation process. Thank you. Over to you, Mr. Choudhury.
Thank you.
Good evening and good morning for everybody. On behalf of PEDSI, I have special thanks to all of you who are attending this meeting, and a special thanks to Cox's Rotary Club and President Hasnain Nayak, Mahmudul Hassan Bhai, Bimal Chaudhary, and PDG Ahad, and other. Thank you for all supporting PEDSI, and a special thanks for joint project for special school health monitoring system in Bangladesh with the Rotary Club in Bangladesh. So before we starting the program, I like to introduce my medical director PEDSI, Dr. Wasim Hafiz. He's going to introduce all of our directors.
Thank you again to Rotary Club, Bazar Shoykot, for inviting us. We feel privileged that we can work with you. I'm going to introduce our members who are here today, and they will also be presenting our proposal to you. We have Zoe Bhakti. He is a pediatric specialist currently working in Houston. We have Sana Semyon. She's the director of our operations, and she's working out of California. We have Fabian, who's a medical director, a medical doctor who is practicing in Georgia. We have Ryan Chaudhary, who is corporate law and patent law practicing in Washington, D.C. We have Maisoon Chaudhary. She is practicing in a nonprofit organization in global health. We have Naima Chaudhary. She's a pediatric pulmonary specialist in Chicago. And they are going to present our proposal to you. I'm going to ask Shamim Chaudhary to briefly say a few words. She is also one of the founding members.
Okay, I'm Dr. Shamim Begum. I'm from New York. I'm basically the treasurer of PEDSI Global Health Organizations, and I usually take care of women's health sections. I know that pediatrics are always inseparable from women's health, so I usually focus on women's health, any preventive lecture series. And also I work in New York State with the mentally retarded and adult population, so I have some interest on focus on their preventive care in future healthcare. Thank you.
So we're going to start off now. We have a brief presentation of our school health proposal. That's what we're here today to talk about. So I'm going to ask Sana to present with your rest of the group.
Okay, great. Yes, thank you so much. As Dr. Hafiz said, my name is Sana Semyon. I have been brought on to very exciting time to be working with PEDSI Global Health right now. For 8 years, these really incredible, energetic founders have been leading missions and programs around the world to really tremendous impact. And the past year or so, they've been very focused on training up some of the young doctors that they have been taking on all of these missions to really expand the scope and focus of the work. So I'm very excited to have been brought on to help with the administration of all of these projects that we've been trying to expand and actually take on some of the next generation of doctors that have been showing up for years for these projects and missions. So very briefly, I'd just like to go over some of our founding principles, some of the guiding principles of our mission. The first is to promote improved healthcare outcomes for underserved populations around the world, to support tangible gains to community health by tailoring initiatives to address specific obstacles facing the community, and to facilitate sustainable ongoing impact rooted in partnership with the local community or organizations. Primarily, our goal is to take the enormous pool of expertise and experience from our medical professionals and partner with local community organizations, service organizations, humanitarian organizations. Yes, to partner with local organizations in order to really amplify the impact of this work that has been pioneered by PEDSI's founders. So without further delay, I'd like to hand it off to our legal advisor, Brian.
Thank you, Sana, and thank you to Rotary Club of Cox's Bazar to allow us to present this topic about our organization. Now, as Sana had mentioned, we are focused on tangible community health outcomes, and we have a sustainability first approach that focuses on education, skills training, and establishing permanent local health services. But we also realize that obstacles of communities face in accessing adequate healthcare are, very complex, entrenched, and sometimes the most practical approach to get to the solutions that we're trying to achieve is to establish direct connections through direct donations, voluntary emergency services, and free clinics. And so the 4 bullet points shown in this slide are examples of actions that our organization has taken to develop these tangible community health outcomes. So the first set of projects we've done are in the Philippines in establishing free medical clinics. With this project, PEDSI volunteered in Capiz and Guimaras in the Philippines, and we provided care and medications to a large number of children that are of low income and indigenous populations. The second set of projects that we've done is with Takashishu Hospital and Chittagong Medical College Hospital, We participated in equipment donations. We've trained physicians in life-saving techniques, and we realized that that's only a part of the solution. In order to develop adequate care, we also needed to provide adequate equipment to implement knowledge and skills. So our focus is not only in providing the equipment, but also the knowledge and expertise that can allow physicians in Bangladesh to use this equipment that was donated more effectively. So we've donated a resuscitation kit, which included defibrillators, AED devices, bag valves, masks, among others. The third set of projects that we've participated in is developing CPR awareness and patient education. We've done this in both Bangladesh as well as in New York with physicians that have been practicing in New York. We've initiated community outreach programs and offered the American Heart Association Friends and Family CPR program to students and parents in the greater New York City area, which has a large Bangladeshi population. The Friends and Family CPR course teaches life-saving skills such as choking, AED use, and it's ideal for students and school children, new parents, babysitters, and others that are interested in learning how to save a life. The last program I'll talk to you about is our global pandemic response. During these times, I think a lot of our team members have recognized that COVID-19 has changed our approach to healthcare, and it's rampantly spread throughout the world, including New York City, Bangladesh, and other places in the world. And PEDSI Global Health has been we've gotten involved in emergency response efforts through training of international medical graduates, as well as spreading awareness and information about COVID-19. We have worked with the governor's office in New York and New Jersey, and worked with foreign physicians to grant temporary licenses to provide medical care during the pandemic. We have also focused on the IMG's basic life support training, which also helped our physicians in New York obtain this special permission to provide care. In terms of helping parents, we've conducted workshops to help parents speak with their children about the COVID-19 pandemic and general practices to promote social distancing during these times. Next slide, please.
Everyone, I'm Mysoon, as mentioned earlier, and I submitted a lot of grants and everything. And I'm really happy to be here to share some of the long-term sustainable impacts of the various activities PEDSI. So as you know, PEDSI's primary mission involves promoting sustained improvements to global health where possible. And we approach this goal in a variety of ways, including providing educational programs and hands-on training in advanced medicine to local skilled health professionals who might have limited access to these kinds of trainings. And the networks and relations that these are built on provide us with access to local medical professionals who can help us sustain our local initiatives and programs by assisting with these trainings, referrals, and program oversight. Along the same lines, PEDSI Global Health participates in programs and services designed to identify doctors with interests that are aligned with service to underserved communities, or actually supporting doctors with diverse backgrounds and experience working with underserved communities who are seeking a bit more advanced medical training. We have provided educational opportunities by arranging a 4-week global health elective for a pediatric resident in March 2017. And this resident rotated through the Apollo Hospital and also ICDDRB. He was involved in teaching some of the training courses as mentioned by Rubaiyat Chaudhary at the top of the meeting. And we really hope to offer these types of opportunities to other residents who are interested in careers that will address domestic and international health disparities. So we also conduct a lecture series. At PEDSI, we've partnered with the Planetary Alliance to offer monthly remote lectures by pediatric specialists on relevant topics to Bangladeshi physicians. And we also conduct a global health conference and workshop in Bangladesh. So in December 2017, we inaugurated the PEDSI Training Center in Dhaka, where we offered lectures and workshops covering a wide areas of topics by experts in the field of internal medicine, family medicine, general pediatrics, pediatrics ICU, pediatric emergency, hospital medicine, and postpartum and newborn care. The small group of interactive sessions included newborn resuscitation care, developmentally disabled, and besides teaching guidelines, non-invasive ventilation and patient care and medical home care. We also conduct a residency application workshop for IMG, and through this, we organize yearly workshops for international medical graduates and medical students who are actually preparing for getting into the US residency programs. So through this PEDSI faculty, we're joined by Bimana New York chapter, and central committee members offer the program. Specialists in the field offered advice on how to prepare for the US MLE steps, how to apply for clinical observationship, assistant in research projects, and volunteers in medical research. Additionally, we have a Rohingya camp in Cox's Bazar. And in November 2018, we conducted hands-on AHA basic life support and neonatal resuscitation program for medical providers through Hope Field Hospital for women in the Rohingya camps in Cox's Bazar. Through this, doctors, nurses, and midwives from Bangladesh, the United Kingdom, Australia, France, and Portugal were all given hands-on training mannequins and equipment for management of and aftercare delivery. After successful completion of the course, all the participants were given a completion card issued by the American Heart Association. And finally, I wanted to mention some of the great advocacy efforts that we're conducting. So our PEDSI co-founder, Dr. Chaudhary, has been selected as one of 2 members to represent New York State in the American Academy of Pediatrics at the White House Initiative on Asian Americans. And the AAP's federal priorities include urging Congress to fully fund maternal and child health programs, which save lives and help development. Next slide, please.
And as my colleagues have mentioned, education and training is our core philosophies to our mission. And to accomplish those core philosophies, we've been focused on providing medical training programs in different institutions as well as different geographies. This slide just shows you 4 examples of programs that we've done in basic and advanced life support, PALS and APLS. And what we're proud of is that since 2012, we provided these training programs to over 300 physicians and nurses in a variety of institutions, including Dhaka Shishu Hospital, Apollo Hospital, Salimullah Medical College, Dhaka Medical College, Dhaka Red Cross Hospital, among others. Our program has also received recognition by both local physicians in Bangladesh, as well as the U.S. Ambassador to Bangladesh, Dan Zana. For the Advanced Pediatric Life Support Program, we've implemented programs in Bangladesh, Zimbabwe, and the Philippines. And what you'll see is we have an ongoing commitment to education and training. In the 5 years that are reflected in this slide, we've conducted programs across different subject matters as well. The first APLS program was focused on Pediatric Emergency Medicine in Bangladesh, and it was sponsored by the American Academy of Pediatrics. If you're not familiar with APLS, it's presented as a case-based discussion of current diagnosis and management of common pediatric emergencies. And we provided this course in collaboration with experienced educators from Bangladesh in Dhaka and Chittagong. And then in September 2015, we were invited by the Heart Life Zimbabwe to teach the first APLS course in Zimbabwe. In March of 2017, we organized the first APLS course in the Philippines and received excellent reviews. And I think what's important to come across from this slide is that we not only focus on certain types of courses, but we focus on different geographies as well. And we remain committed to continuing that mission of spreading education and training as our core philosophy. Next slide, please.
Assalamu alaikum. My name is Fabian Chang. I'm a primary care pediatrician with an interest in public health and preventive medicine. So I'm very happy to speak today about the PEDSI School Health Initiative that we are proposing. So as many of you already know, just in terms of the global community, we've made significant headway in reducing worldwide poverty, with a lot of that improvement coming from places in Asia, like Bangladesh, India, China. However, these improvements in economic conditions have not necessarily translated to sufficient access of general healthcare services, preventative care, overall hygienic environment for children, all of these resulting in continued health issues. We believe that these health issues can be significantly curbed by implementing simple but also inexpensive interventions through our School Health Initiative program. Our program addresses these challenges related to poverty, school environments, malnutrition, communicable diseases, and all through using the existing school infrastructure that's in the communities that we hope to serve. So to speak a little bit more about the nature of these problems, the problem of inadequate healthcare and infrastructure and insufficient access is a problem in many places in the world, as I stated, and necessarily increasing the income of the individuals in these communities has not, like I said, translated to the society kind of being able to keep up with these health demands, particularly related to preventative care. And even in the United States, where income is relatively higher, many people lack access to a medical home where a lot of the preventative medicine takes place. And what we mean by preventative care is that includes healthcare monitoring of certain parameters, vaccinations, nutritional guidance, and importantly, like education, promoting health literacy, particularly related to nutrition, how infectious diseases are spread. And as we know, poverty, education, health often go hand in hand, which ultimately leads to health problems in adults that begin mostly in our pediatric populations. So go on to the next slide. So what are our goals of the initiative? So the goal of the PEDSI School Health Initiative is to provide health services to children in, particularly rural communities that lack adequate healthcare infrastructure, and support the health-related concerns of the community, such as, like I stated, nutrition, hygiene. We know from experience in global health that school health services has been a vital solution to public health concerns in many communities, and particularly in low-income and underserved communities. And the successful implementation can kind of transform these schools from just schools to like community health service centers and medical homes that can provide a lot of basic services and provide a lot of information to our targeted populations. So specifically, our program has been designed with these following kind of aims. So approximate healthcare outcomes for school-age children. So school-age children are, as we all know, susceptible to lots of medical problems, but a lot of these medical problems can be detected and prevented. So we want, as I've stated, relatively simple interventions that are inexpensive to prevent escalation into these chronic conditions as adults. So we want to build up the infrastructure in these rural communities through the schools and the individuals that we would hope to train at these facilities. We want to work closely with the schools to implement these programs, but ultimately, we want this to be sustainable, and so that the training can kind of move forward from there. In terms of the second one, tangible community health gains that are sustainable without reliance on skilled healthcare workers. So I've kind of alluded this just a second ago. So a lot of the medical issues and interventions do not necessarily need, many years of medical school or nursing school, to be able to implement. So what that means is, collection of certain measurements like height, weight, blood pressure, vision testing. These are all things that can be done by a layperson that's trained and to do these specific measurements. We would like to prioritize training school teachers, but also older students who may be interested in helping their community. And we believe that is a method of making this a more sustainable process. In terms of how that affects the community sustainability outside of the school as a medical home, schools obviously are an important part of this program, but we are hoping that it goes beyond the school and into the community and into the homes. So, between teachers that are trained as these kind of community health representatives and the teaching that they would do to the local community and the parents, we think that infrastructure would be built and that influence will be felt throughout not only families, but the rest of the community. In terms of promotion of health and hygiene, I spoke briefly about this earlier again. Our aim is to support all initiatives that are aimed at educating the community and increasing awareness of hygiene practices, particularly important in the setting of a global pandemic with COVID-19, obviously, as well as nutrition, making sure that parents are aware of kind of vaccination schedules and when those should be happening. And finally, in terms of, any kind of medical intervention, I think data and building upon successes is important. So we will be looking at collecting data, looking at particular measurables such as, how many kids are being how much of the data for these school populations is being collected. We want to obviously do that with multiple schools. That will be analyzed by us and through our partners to spot, particular areas where we can improve the quality of the healthcare access. I guess next slide. Sorry, 1 second, my computer is being... In terms of the community profile, who do we want to target? So first, rural communities lacking in adequate healthcare, like I said. Our program is designed to address gaps that exist between government programs, private hospitals, and the school. We hope that there will be a more kind of comprehensive healthcare available to these communities. And we want to target mostly small kind of rural communities where we can have the most, affect the most change. Another thing we're looking at is, areas that have a low ratio of skilled health workers. So the school health initiative is recommended for communities that fall short of the minimum standard requirement, by the WHO, which is 4.45 skilled health workers per 1,000 people. And we believe that when there's a lack of healthcare workers, the most impact can be had. The other thing that we're looking for is substantial school attendance. We are designing this program to address students that are school age, that are between 5 and 18. And it's ideally suited for places where children are going to school and can be affected by this change. And then we're also looking at places that have a lot of need in terms of nutritional deficiency and other conditions that can be addressed by kind of these low-cost interventions that can be effected through our training program and through education. So, specifically, we're looking at malnutrition, dental problems, kind of infectious diseases, hearing, vision problems. Okay, and then in terms of what the roles and responsibility of these healthcare workers would look like. So in many countries, and including where I'm working in the United States, the school nurse is a really important part of the medical monitoring of a lot of students. But, you know, as I've said, you don't need to be necessarily a trained nurse to carry out a lot of these tasks. So what we'd like to see is that these individuals that we're training, that are teachers or older students, can work in this kind of non-medical role, non-traditional medical role of school health coordinators. Our proposal is to facilitate the training of these teachers to do preliminary health assessments for the children. Once the problems are identified, we can then transfer that care to a doctor who will be assigned to go to these schools on a, you know, some sort of scheduled basis to address the problems that are detected. We're going to be holding seminars to train these teachers in each school. We already have a school health manual that we've been working on that should standardize a process in every school as well. Specifically, you know, I won't go into the full details of the manual, but you know, the kind of aspects of healthcare that we want to address are going to be infectious diseases, malnutrition, both, you know, low nutritional status, but also obesity. For our teenagers, things like substance abuse, STIs, and mental health as well. So each school will have 2 to 3 teachers, hopefully 1 male, 1 female, preferably with a kind of science background, but, you know, not necessary as well. They'll be designated as school health coordinators. They'll be selected by the school advisory board and headmaster. And these individuals will be assisted, like I said, by kind of older students who have an interest in kind of fulfilling the community role that are picked by these teachers. This will allow the teachers to kind of work more efficiently, give the students a lot of experience and confidence. And obviously our organization will work with them to do the training process. We will be having you know, 1-day training programs for core groups of these healthcare coordinators by us and our medical professionals, but also our approved kind of local partners as well. The training will cover basic health monitoring, vision health screening, dental, detection of malnutrition, and overview of common mechanisms for follow-up treatment. The trainees will be provided with tools for the health record maintenance. They'll receive basic kind of CPR training, first aid training, according to the AHA guidelines, and then be provided a certificate of completion as well. So the school health coordinator role can be tailored to lots of different communities. So the way we envision this is that, you know, they can provide like playground safety for kids, make sure that there's, you know, adequate levels of physical activity in children. They can work to screen for depression, especially, you know, in a setting of global pandemics. I think this can be particularly important. You know, provide suicide prevention plans, identifying teenagers at risk for tobacco or drug abuse, and do counseling based on that. Conducting health education classes for students. They can promote personal hygiene for the women, menstrual health, and just overall partnering with local communities, community leaders to promote healthy living throughout the community.
Thank you, Dr. Chang. Please let me know if you can't hear me. I'm Zoe Bafiz, a physician at University of Texas at Houston. I am just going to build on what the other speakers have said and talk a little bit about the potential connection and the collaboration between PEDSI and the Rotary Club of Cox's Bazar. I will try my best not to restate anything that's already been said. and kind of just taking a step back and restating just briefly what Dr. Chang had mentioned as to what the actual needs assessment is. Many of you guys already know this, right? Like Bangladesh has a shortage of physicians. It has 0.5 doctors for every 1,000 people and 0.2 nurses for every 1,000 people. The World Health Organization recommends 2.28. On top of that, these physicians and nurses tend to be clustered in urban areas, leaving rural areas at a highly disproportionate shortage. High out-of-pocket payments for a lot of these rural and urban families for health services, medicines, informal payments of medical services. It's exhausting millions of households around Bangladesh. And Bangladesh has done a remarkable job in terms of infant and child health, but there's still a lot of work to be done, right? So stunting is as high, growth stunting in children is as high as 36%. Stunting, wasting, underweight cases are in the millions respectively, according to the World Bank in 2016. So what does PEDSI offer, right? We offer an international collaboration, but we also have roots in Bangladesh. I was gonna just, if you don't mind going back just a second. We also have roots in Bangladesh and are aware of the local issues that can help with some of those small things that make it difficult to run a local project with an international collaboration. And we have almost a decade going back of working with Chittagong programs, Cox's Bazar programs, and we've developed good working relationships with the local communities. So next slide, please. So a little bit, I'm going to tell you what you guys already know. The Rotary Club is an international humanitarian organization that's over 100 years old, right? You guys have worked for over a century with a mission of bridging cultures, connecting continents, championing peace, fighting illiteracy, poverty, promoting clean water, sanitation, fighting disease, on and on and on. You have 35,000 local clubs worldwide. So we believe that PEDSI's school health initiative is a great opportunity for mini collaboration between our organizations. We feel like there is a lot of overlap in that mission. Each successful, so going to the bullet points on the slide, there's a couple of things that make this collaboration potentially very meaningful. One is, one of the nice things about this particular school health initiative intervention is every time we go into a community, we're planting a seed. One of the things that I think one important thing that our intervention is we are not something that goes away the moment we leave, right? We plant a seed, and like Dr. Chang noted, we're focusing on school teachers and other community members, including students, and saying, this is what you guys can do for your community, and just providing guidance, right? And once we get in there and do that, and that provides a seed twofold ways. One is that these community members now know how to do this, right? And then the kids are better off for it, and now that can be potentially generational. The second point is this is easily tailored to individual communities. One thing that I think everybody has known is something I call parachuting global health, right? Somebody comes in, does something, and then it's like, great, that was great, but what about the next neighborhood over? What about the next community over? What about the next community over? They're not the same, right? They're all different. So one of the things that we're excited about with the School Health Initiative is the ability to tailor this to individual communities, because this is supposed to be low cost, it's supposed to be sustainable, and this is supposed to communicate and sort of be collaborative with those teachers, those identified those identified students. And then the last point is, we are a small group of motivated professionals. You're meeting all of us now, right? We feel like we have an expertise. We feel like we have the capability and the experience to make an impact in your community. But we have to partner with organizations like the Rotary Club, diverse local volunteers who are dedicated to humanitarian service in their community, to sort of guide the implementation of the program in more and more and more communities. You can go to the next slide. So Bangladesh, again, I'll tell you things that you already know, but just to kind of give a bird's eye view of Bangladesh, there are 2 Rotary Club districts, right? 3281 in Dhaka in Western Bangladesh, 3082 in Eastern Bangladesh. Chittagong, Cox's Bazar, Sylhet, and others. Dhaka is the capital city. It has exposure to multiple large and local international exposure. And it may not, a lot of the interventions being done may not be available in smaller cities. 3282 has about 30 current projects, including polio eradication, small screen addiction, and 3281 has about 60 projects. But as far as we know, there's no current international collaboration projects. And for us, we feel like that's an opportunity. So what's the proposal? So the proposal, just going slide by slide, point by point. The first point is to identify a feasibility of setting up a model for school health monitoring in Bangladesh and specifically in these communities. Then, and I think we're very excited about this next point, is to address and embrace the specific obstacles we encounter. And then take a step back and going to the second point. Then we'll reach a consensus and say, you know, how are we impacting the overall health and well-being? How are the notes from the obstacles? How do we adjust our program to meet the needs of these communities? We plan to expand, and after that, we plan to expand, refine the program, and then reach more schools and more communities and more rural areas. We have a commitment to improving the health and well-being of children around the country. I think that sentence is something that all of us have internalized. That's why we're all here. And then the third point, the third bullet point, is I think also very important, and one of the reasons why I think we're all here together is because we look forward to an ongoing relationship with voluntary organizations like the Rotary Club who want to partner with us and be involved in the implementation of this project. So Dr. Chang did a really good job of explaining this, so I won't go too much into what we're doing unless there's anybody who wants to refocus on one of these bullet points. But the first point is what I'd like to focus on this particular slide because I think it's important, and I think anybody who's been in medicine, who's been in global health, who's been in advocacy, and anybody who's been who's lived long enough, I think, has seen this in their lives. An ounce of preventative care is worth a pound of curative care, right? I mean, that's the definition of public health, and I think that's why we're all here. If you can find the problem before it occurs or just when it occurs, that's way better than having the best doctor in the world. You know, you go to Dr. Chang's clinic and he's a genius, but you're already 5 years into this disease, and he can only do so much. What we're trying to do is use that penny to prevent these diseases from even happening, right? And identifying as soon as you can identify. And the second point is community involvement for health promotion and health education, empowering these communities to do that themselves, right? All we're doing is we're going in there and teaching, and we're going in there and giving them the tools to do what they need to do. But we're hoping that at the end of our intervention, they're nodding their heads and they're like, yeah, no, we get this, we know this. The third point is this is cost effective. Money's finite, whether you're in the United States, Europe, or Bangladesh. Bangladesh's medicine has come leaps and bounds even over a decade. But nurses and doctors are still rare, especially in rural communities. So we're empowering teachers and community members to do this cost-effective program. And then there's the fourth point, excuse me. We know that there's 80 local clubs in District 3281. What that means to us is that maybe we can get into 80 different schools and benefit the whole district, and then let that compound on itself and sort of get the exponential gains from that. So I believe this is my last slide. So these are the last 3 points, and then we'll open it up for questions. So the first point is with its network of, so this third point is, I think, the first point I think is a good one that I think a lot of people have, anybody who's been involved in public health, but has only looked halfway has found, which is you identify the problem and then you don't know what to do about it. Like, okay, great. You found a community, you found a group of children, a cohort of children that need intervention. Well, I think one of the things that we bring to the table, PEDSI Global Health, is that we have a network of Bangladeshi physician colleagues. so that we can provide definitive care to those kids who are identified to have problems during school monitoring. We know how to, we can start to take the next steps and get these kids the help they need if we find issues. The second bullet point is that we have a manual detailing all aspects of health monitoring to the school children, offer initial training and offering ongoing support to teachers. You know, we really don't want to be, like that phrase I used before, parachuting in with our intervention and then parachute out. Or I guess you can't, you know, whatever, leave. And we want to be available for these communities to make sure that we're there for them virtually, via email, and via our friends on the ground to make sure that they can get the help they need and make sure that we're available for them. You know, we're a network of physicians both in Bangladesh and United States, and we want to utilize that network for the behalf of these kids. And then the last point, and then that'll be the end of my presentation, is the data analysis. So we'll be doing we'll be working with a lot of schools, hopefully. We'll be working with the Rotary Club, hopefully, and we'll be working with organizations on the ground. And we'll be getting all of these data. One of the other things that I think excites us a lot is you know, I'm doing a Master's of Public Health and doing epidemiology and data analysis for the University of Texas Medical School. We have faculty in Chicago, we have faculty in New York, all in medicine. We have people in tech, we have with a history of in tech in California. We have a history of advocacy in Washington, D.C. and law. We have all worked with data analysis, and we've all bring unique abilities to look at data from a fresh perspective and then help these communities again and say, you know, we're seeing some themes here in your data, and maybe we can sit down and figure out ways to maximize the benefit of the health of those communities. So, yeah, no, that's it. That's the proposal. So thank you for taking the time to listen to us. And I'll give it back to the founders and Dr. Vincent.
Thank you, all of you. Is there any questions, discussion? This is the time for discussion.
Yes. Thank you. Thanks a lot to the PEDSI team here who have made their presentations and the collaboration proposal as well. Can you hear me?
Yes.
Yes.
So the floor is open now for question and answer and discussion and suggestions as well. So if you have any question, you can unmute your speaker and then you can speak.
Thank you very much for the discussion, good discussion. We came to know the PEDSI, how it works and how it will work with the collaboration of the Rotary Club. I want to know the approach, how you feel your mission in the Rotary Club of Kapsoda Sheikh and when. Am I clear about my question?
Okay. Can you repeat, please?
I want to know the methodology of fielding the mission, the work at the club level or the community level, and when we are expecting the fielding.
Dr. Chaudhary.
So basically we already started a collaborative process since last year. Because of pandemic, we had stopped for the field work. But again, as soon as the local authority, means local side is clear, then we'll start doing school. And again, it depends on the Rotary Bangladesh or Cox's Bazar Rotary. And they have to select the school and select the teachers, and then we'll have a communication between us. Okay. Our target was initially to start on this winter, the November. We will go there, we will start the training, but unfortunately it's not happening now because of the pandemic. So I ask at the floor also, what will be the alternative way we can start on?
Okay. Is there anybody else?
Wasim?
We have done a pilot study the year before in 7 schools with another voluntary organization. But I think the best approach for something like this initiative to succeed is to start a pilot project. If we do a pilot project over the next few months, what we can do. So basically, if we have a pilot project, the pilot project will direct us to what our health needs are going to be. That's what we did with another organization. We got enough data to suggest what are the weak links in the program. So I think the best way would be if Rotary Club, Cox's Bazar could select a few schools and then select a few healthcare coordinators. We could start implementing. We already have a school health manual, which is very user-friendly. It gives you all the instructions that anyone who reads it will be very easy to identify. In the past, we've done, we've gone to Cox's Bazar, we've gone to Chittagong, we've gone to Dhaka and held in-person workshop for the teachers. That will not be possible this year, but like just what we are doing right now, we can do a Zoom project, and it's possible to explain the whole project by Zoom.
Yes, that is another way, because we, if really we want to do something, then we have to start, and the Zoom is another options to fielding the project. But the manuals. The manuals are those manuals are in English or Bengali?
Currently, it is in English, but our proposal is that with Rotary's help, if we can convert that, translate that, I think it will be much better.
It should be in Bengali, because the people who will work. That will not be user friendly.
There's no question that they should be in Bangla, yes. But
basically, my another question is, we discussed before that Mr. Chaudhary, Dr. Chaudhary was there in the last discussions. We have some schools, the Amarat schools, and they are the children's, and we can select those things. Perhaps you also visited that one, those things. Now we have to select some of the volunteers who can volunteer on behalf of it.
Amarat is a separate project. They visited only one school, that is Cox's Bazar Airport Pilot School. They visited.
Okay.
Can I add to that? I think what they have said is, first of all, we must thank to PEDSI. And I didn't know the big team is working, and the young, energetic team is there. So it's very heartening to know and see that these people are with us. Firstly, I would rather suggest, as per the program is concerned, that PEDSI, what you have said or you have presented today, it should be need-based, which you are doing at present with Cox's Bazar Shoikat, our airport school. So the presenter was telling very nice thing, the planter seed. So Cox's Bazar, the airport school can be one of the school as a pilot project. And from there on, we can disseminate to other schools.
They are doing it now.
Which you are
doing it now. It's going on.
Right. Which you are doing, that has to be more, we can spread. Because of the pandemic situation, the PEDSI program is very relevant. The hygiene, sanitation, other education program, that what they have said before the pandemic, it is very timely. So I think PEDSI and our Cox's Bazar Shoikat can continue, and with this Zoom, we can carry on our program. That's my idea.
So, I attended one of their workshops in Dhaka. thinking about a year back. Dr. Wasim, Dr. Hafiz and Dr. Chaudhary, both of them were there. So they have certain indicators based on which the assessment is done. So those indicators, the teachers, the selected teachers are trained to check the indicators. There might be blood pressure and other things. So they have list of indicators which they have to check, and then they have to take the data. They have to record the information, and then they have to send it back to PEDSI for the data processing. So this is the basic modality, but as we have discussed the methodology which Rotarian Schwab has raised. So regarding methodology, Dr. Hafiz has already proposed that the Rotary clubs can select the school and select. We don't have usually the health coordinator in the schools. So we have teachers. So what we have to do, or what we usually do, is we assign one of the teachers or a number of teachers for this kind of work. So that is one issue. And then, so these selected people will be, selected teachers will be trained on checking the indicators and recording. And then there is a perennial question we discussed, what we discussed earlier is, after you screen the children, then sometimes some of the children might need some kind of intervention, which may not be available within the vicinity. So then we have to take care of that. If we don't do that, then what happens is people become sort of, they feel that it's not making any impact in their life. So that's a question we have to take care of. And regarding the training, what I feel is there are a lot of things which can be trained on Zoom. And as you are doing it already, I think we can start a trial, start a pilot on Zoom training, how to see how it turns out. So that is also another issue, because our people are used to hands-on training through physical presence. And a lot of, a few months back, we have sponsored teachers from 2 different schools to have training on English teaching through Zoom. So things are changing now. So it needs to see how we can improvise to our advantage. So that's one thing. And manual is there. So it has to be, one is it has to be translated into Bangla. And then reading is not an easy thing in our context. So we have to make sure that whatever reading material we provide, it is read. So sometimes you see that you have provided books to people with the understanding that they will go through it and act accordingly. And sometimes it never happens. So this is sometimes very heartbreaking to hear, but it does happen. So that we should, I think, address. So back to Dr. Chaudhary or Dr. Hafiz.
Anyone of them having any questions regarding our project or collaboration?
By the way, we have our Assistant Governor, Rotarian Amorish Borua Chaudhary. So, আপনি যদি কিছু বলেন এই বিষয়ে।
ধন্যবাদ প্রেসিডেন্ট সেক্রেটারি আইপিপি এন্ড পিপি কক্সবাজার সৈকত, সবাইকে আমি ধন্যবাদ জানাচ্ছি। আমি আপনাদের সাথে আছি, আপনারা কন্টিনিউ করেন, সবার জন্য শুভকামনা রইল।
ধন্যবাদ। পিডিজি আহাদ আমাদের সাথে আছেন। আমরা তার কাছ থেকে শুনতে চাইবো, কিন্তু তার কাছ থেকে আমরা একটা এডিশনাল ভূমিকাও আশা করবো, সেটা আমি একটু পরে বলছি। উনি সবসময় আমরা ওনাকে রিজার্ভ ব্যাংকে রাখি, তো আজকেও তাই উনি আছেন। আশা করি যে উনি আমাদের সঙ্গে শেষ পর্যন্ত থাকবেন। সো রোটারিয়ান সমীর চৌধুরী আছেন কলকাতা থেকে। দাদা, উড ইউ লাইক টু?
কলকাতা না, উনি আসানসোল, ওয়েস্ট বেঙ্গল, আসানসোল বর্তমান।
আসানসোল, রাইট। থ্যাংক ইউ ফর দ্যাট।
গুড ইভিনিং টু ইউ অল ওয়ান্স অ্যাগেন। তো এনিওয়ে আমরা তো সবসময় আপনাদের সাথে আছি।
ভালো বৃষ্টি হচ্ছে।
অল দ্য বেস্ট। থ্যাংক ইউ।
হ্যালো, আসসালামু আলাইকুম সবাইকে। যেটা ভালো লেগেছে যে এখানে অনেক কাজ হচ্ছে। অ্যাকচুয়ালি আমার এই সম্পর্কে কোনো ধারণাই ছিল না। এখানে যে স্কুলটা যেটা আমি শুনলাম, এই যে পেডসি যেটা সেটা সেই রিলেটেড যেগুলো শুনেছি কিছু কিছু, তো সেটা আমার কাছে খুবই ভালো লেগেছে। এই জিনিসটা আসলে আমার ধারণা ছিল না। তো আই হোপ যেভাবে কাজ হচ্ছে সেটা কন্টিনিউ হোক, এবং আমি আপনাদের সাথে ইনভলভ হতে পেরে খুবই আসলে আনন্দিত, এবং আই উইশ অল দ্য বেস্ট ফর দিস অর্গানাইজেশন। থ্যাংক ইউ ভেরি মাচ। আসসালামু আলাইকুম।
আমাদের স্কুলে শ্রেণীর কাজ হচ্ছে ক্লাস ওয়ার্ক, আর একটা হোমওয়ার্ক দেওয়া হতো যে বাড়ি থেকে করে আনার জন্য। তো আমরা সেই কাজটা চিন্তা করছি, এখানে আজকে যারা উপস্থিত হয়েছেন সৌভাগ্যক্রমে কিংবা দুর্ভাগ্যক্রমে, আপনাদের জন্য হোমওয়ার্ক থাকবে। আমরা এই যে আজকে পেডসাই প্রেজেন্ট করলেন, ওনারা বিভিন্ন এখানে তাদের অ্যাক্টিভিটি তুলে ধরেছেন এবং তাদের প্রপোজাল, তারা কিভাবে কাজটা করতে চান আমাদের একটা ধারণা দেওয়ার চেষ্টা করেছেন। তো সেটা আমরা আপনাদের কাছে পাঠাবো এবং উই উড লাইক টু হ্যাভ ইউর ফিডব্যাক। অনেক সময় আছে তাৎক্ষণিকভাবে সবকিছু পর্যালোচনা করা যায় না, একটু সময় দিতে হয়। তো সেই সময় আমরা আশা করবো যে আপনারাও দেবেন, আমরা আপনাদের সবার কাছেই এটার লিঙ্ক পাঠাবো। এটা হচ্ছে একটা ব্যাপার। আর ডক্টর চৌধুরী অথবা ডক্টর হাফিজ, আপনাদের কি কোনো ক্লোজিং যদি রিমার্ক থাকে সেটা বলতে পারেন। আমার ছোট্ট আরেকটা রিচুয়াল আছে, আপনাদের পর আমি সেই জায়গাতে যাব। ডক্টর হাফিজ আর ডক্টর চৌধুরী।
Thank you. So thank you very much, everybody. It's a very fruitful discussion. I hope we'll continue the same type of program in future, because one meeting we cannot resolve everything. So I think thank you all of my directors, Ryan, Maison, Fabian, Zoeb, Sana, and Tulip, everybody. Thank you for all your support and presentation. Hopefully in future we'll continue the same side of discussion and other project. And if you feel free to communicate with us in future if anything to improve this meeting discussion. Thank you all.
Yes. Thank you. From the discussion and question and answer, the points I could note down are one is the methodology, how to do it, and then the proposal for a pilot run, and then the Rotary Club can play a role through selecting the schools and the teachers. And then regarding teachers training to do the work, we can explore training through Zoom. So these are the few points I could note down. So, and also the manual which has been done in English, that has to be done in Bangla. It has to be translated. And also, as I have mentioned, we have to make sure that it's read and followed. Okay, Dr. Chaudhary raised his hand. Let me let him flow. Dr. Maksud Chaudhary. You have to unmute your speaker.
Regarding the translation of the guideline book, I'll request Totumbur can take this part. Is it possible?
Good idea.
Okay.
Good idea.
Okay.
Right job for the right people.
we can explore, of course. Okay, and then thank you.
হাসনাই বলেছেন হাত ভাইকে আমরা রিজার্ভ স্টকে রেখে দিই সবসময়। এই ধরনের একটা অনুষ্ঠানে বক্তব্য রাখছিলেন, সবাই হল ছেড়ে চলে গেছে, একজন খালি রয়ে গেছে। তো বক্তা অবাক হয়ে তাকে বলছেন সবাই তো হল ছেড়ে চলে গেল, আপনি কেন রয়ে গেলেন? যে স্যার আমি রয়ে গেলাম, ওই পোডিয়ামের যে কার্পেটটা সেটা আমার, আপনার স্পিচ শেষ হয়ে গেলে কার্পেটটা আমার নিয়ে যেতে হবে, সেই জন্যই। So I am that carpet that I have to take it first of all. Thank you. কক্সবাজারে কোনো প্রোগ্রাম হলেই
আমি সেটাই বলতে চাচ্ছিলাম পিডি জাহাদকে, উনি যে লোকটার কথা বলছিলেন যে কার্পেট নেওয়ার জন্য, তো কোইন্সিডেন্টালি ওই রোলটা হচ্ছে এখন আমার, কারণ আমি হচ্ছি হোস্ট, আনলেস দ্য লাস্ট পারসন লিভস আই ক্যানট সুইচ ইট অফ। তো যা হোক, আমি ওনার জন্য যে কাজটা রেখে দিয়েছি সেই কাজটা খুব ভালো কাজ, এবং আমাদের জন্য এটা একটা অনেক বড় কাজ আর কক্সবাজার সৈকতের জন্য, that we have him to do that। সেটা হচ্ছে এখানে শামীম বেগম আছেন, ডাক্তার শামীম বেগম, ডাক্তার মাকসুদ চৌধুরী and ডক্টর ওয়াসিম হাফিজ। So 3 doctors we have। তো তারা আমাদের রোটারিতে জয়েন করছেন, রোটারি ক্লাব অফ কক্সবাজার সৈকতে। তো আমি মনে করি যে এখন তো অবশ্য মানে আগে হলে একটা ল্যাপেল পিন করে দেওয়া হতো বা কিছু একটা করা হতো, তো আজকে যেহেতু আমরা পিডিজি আহাদকে পেয়েছি, উনি এই 3 জনকে আমাদের ক্লাবে ইন্ডাক্ট করবেন। So this becomes actually red letter day for I mean on many counts। একটা হচ্ছে আমরা এই যে পেডসি যে প্রজেক্ট সেটা নিয়ে আলাপ করছি, এবং আমাদের সঙ্গে আরো 3 জন যুক্ত হচ্ছেন রোটারিতে, এবং সেখানে পিডিজি আহাদ আছেন। এগুলো সব মিলিয়ে আমাদের জন্য এটা একটা খুব মেমোরেবল ডে। সো এখন আমি সেই রিচুয়ালটা করার জন্য পিডিজি আহাদকে অনুরোধ জানাই।
থ্যাংক ইউ। ডক্টর মাকসুদ চৌধুরী, আর ইউ going to be a Rotarian today?
Yes.
Okay. Do you know one thing? When you take loan from a bank, you are in debt with that bank. You try to repay that money to the bank. And when you are in Rotary, someone must have called you in Rotary, so you are in debt with that person who has brought you to Rotary. You can only repay that debt if you include in the other Rotarians to this forum. Then only you can pay up that loan of debt to Rotary. So I hope you will bring more Rotarians to enrich Coxbazar. Coxbazar is booming with a lot of activities, as I hear from other speakers. Good job done. And our subject today is healthy kids, better learners. I can tell few words about what does healthy kids means. In my definition, health can be divided into 3 categories: physical health, mental health, and mental illness. They are all different, I should say. Health, as you can see a kid that he is healthy, he is taking good nutritious food, and he is healthy. But mental health is something which has to be developed from the home, from the family. And what is then mental illness? Mental illness is how that kid can project himself, how that kid can say what he wants to say so that he can motivate other people. Suppose, for example, if I am the speaker, I must tell the audience in such a way so that I can vent my views. That is a skill. If I cannot do that, that is my mental illness. Mental health can be arrested by the person himself, and mental illness has to be developed through practice. If you want to be a good speaker like Hasnain, you have to speak in front of mirror and see yourself what you are talking. Kids are also to be taught that way so that they can express themselves and can go over that mental illness. So a mental illness is an illness that affects the way people think, feel, behave, or interact with others. যেটা আমি বলছিলাম বাংলাতে, health is not like an on-off switch. There are different degrees of health. These degrees could be great or good health, so-so health, poor health, or illness or disability. These are the criteria of health যেটা World Health Organization define করে। আপনারা সবাই হয়তো টায়ার্ড হয়ে গেছেন বক্তব্য শুনতে শুনতে। I will not take your time, but I will surely say that you always love to hear my choked voice and broken voice, so that's why I feel like coming to your meeting again and again. With the right supports and tools, anyone can live well, however they define well and find meaning, contribute to their communities. একটা পরিবারই তাকে এই ইলনেস থেকে, মেন্টাল হেলথ থেকে উদ্ধার করতে পারে। পরিবারের শিক্ষাটাই হলো একটা শিশু হেলদি হওয়ার ইন অল ডাইরেকশন প্রাথমিক শিক্ষা। একটা ছেলে একটা পরিবারে শুরু থেকে মারা যাওয়া পর্যন্ত একটা বায়োগ্রাফি লিখেছিল। ইন দ্যাট বায়োগ্রাফি হি সেড, বাবা আমি ভূমিষ্ঠ হওয়ার পর যখন লোক চিনতে পারলাম, আমি তোমাকে দেখেছি বাবা, তুমি যে আমার বাবা। আমি যখন বুঝতে পারলাম, আমি হামাগুড়ি দিতে শিখলাম, আমি হামাগুড়ি দিয়ে দিয়ে তোমার কাছে যেতাম, ভাবতাম তুমি হয়তো আমাকে কোলে তুলে নেবে, তুমি কোলে তুলে নাও নি। আমি যখন হাঁটতে শিখলাম, আমি হেঁটে হেঁটে তোমার কাছে যেতাম, হাত তুলে দিতাম, ভাবতাম তুমি আমাকে কোলে তুলে নেবে, কিন্তু তুমি আমাকে কোলে তুলে নাও নি। আমি খুব সুন্দর আর্ট করতে পারতাম, মনের সমস্ত ভালোবাসা দিয়ে আমি তোমার একটা ছবি এঁকেছিলাম। আমি তোমাকে সেটা প্রেজেন্ট করে বলেছিলাম, বাবা দেখো আমি তোমার ছবি এঁকেছি। তুমি একটুখানি দেখে বললে হ্যাঁ খুব সুন্দর হয়েছে, আমি পরে দেখবো বলে ছবিটা তুমি সোফার উপর রেখে দেবে। এইভাবে পদে পদে আমি রিজেক্টেড হয়েছি। পরে যখন আমি ইউনিভার্সিটিতে উঠলাম, আমি ভালো ফুটবল খেলতাম, ফুটবল টিমের ক্যাপ্টেন ছিলাম। আমি তোমাকে বললাম, বাবা এইবার অন্তত তুমি আমার ফুটবল খেলাটা দেখতে এসো। আমি খেলছিলাম আর দিকে তাকাচ্ছিলাম, বাবা আমি তোমাকে দেখিনি। আমি ভেবেছিলাম এটাই হতে পরিবারের সংজ্ঞা, মেবি দিস ইজ দ্য ডেফিনেশন অফ এ ফ্যামিলি। আমি বীতশ্রদ্ধ হয়ে আমি তখন বড় হয়ে ভাবলাম এই ফ্যামিলিতে আমি আর থাকবো না। ফ্রন্টে যখন যুদ্ধ লাগলো, আমি ভলেন্টারিলি সেই যুদ্ধে নাম লেখালাম। যুদ্ধে যাওয়ার আগে আমি আমার বাবাকে বললাম, বাবা আমি যুদ্ধে যাচ্ছি। তখন বাবা তুমি আমাকে জড়িয়ে ধরে বলেছিলে, বাবা তুই কেন যুদ্ধে যাচ্ছিস, আমরা তো তোকে কত ভালোবাসি, তুই যাস না। তখন প্রথমবারের মতো তুমি আমাকে জড়িয়ে ধরে তুমি কেঁদে বলেছিলে তুই যুদ্ধে যাস না। কিন্তু আমি তো নাম লিখিয়ে ফেলেছি, বাবা আমার যেতেই হবে। বাবা তোর যদি যেতেই হয় তাহলে কথা দিয়ে যা যুদ্ধ থেকে ফিরে আসবি। কিন্তু বাবা আমি তোমার কথা রাখতে পারিনি, আমি যুদ্ধে মারা গিয়েছি এবং সেই যুদ্ধ থেকে আমি ফিরে আসতে পারিনি। তবে তোমার কাছে আমার একটা প্রশ্ন, তুমি যদি সত্যিই আমাকে ভালোবাসতে, হয় তুমি এটা এতদিন পরে বললে কেন, কেন আগে বললে না? সো when you love your son or daughter, do not wait to tell him day after tomorrow. Tell him now, today, because tomorrow may be too late. এই ধরনের পরিবারে মানুষ আর শিশুরা কিন্তু মেন্টাল ইলনেস এবং মেন্টাল হেলথে সাফার করে। সেইখানেই রোটারি এগিয়ে আসে, সেখানেই আমাদের এগিয়ে আসতে হবে, সো দ্যাট থ্রু অ্যাওয়ারনেস প্রোগ্রাম আমরা সেই ফ্যামিলিকে কিছুটা অন্তত দীক্ষা দিতে পারি হাউ টু লুক আফটার ইউর কিডস। আমি খুবই খুশি হয়েছি আমি এখানে এসেছি। অ্যাজ আই সেড, I will not bore you with my choked and broken voice, and আমার কার্পেটটা নেওয়ার সময় হয়েছে। হাসনাইন আমি আমার কার্পেটটা নিয়ে যেতে এসেছি। থ্যাংক ইউ ভেরি মাচ, থ্যাংক ইউ এভরিওয়ান।
অনেক ধন্যবাদ পিডিজি আহাদকে। আমরা একটু ছোট্ট করে অ্যামারক সোসাইটির সঙ্গে যে কাজ করছি সেখানে ওনারা এটাকে বলছেন মাইক্রো স্কুল। একজন মহিলা বা শিক্ষিকা উনি 25 জন মাকে শেখাচ্ছেন। সেই 25 জন মা আবার তাদের পরিবারের আশেপাশে 5 জন শিশু কিশোরকে শিক্ষা দিচ্ছে, ছোট একটা ফর্মে। তো সেখানে প্রথম যে টিচার আছে তাকেই লেসন গুলো দেওয়া হচ্ছে এবং সো দ্যাট শি ক্যান ডিসেমিনেট। এখানে আমরা একটা মডেল হয়তো চিন্তা করতে পারি, যদি আমরা স্কুল ভিত্তিক নাও যেতে পারি। এটা হচ্ছে যে ফ্যামিলি এবং স্কুলের মাঝামাঝি একটা মিক্সড আপ মডেল, মাইক্রো স্কুল বলছেন ওনারা। সেখানে আমরা চিন্তা করতে পারি যে পেটসাইয়ের যে মেথোডোলজি আছে সেটার একটা আরেকটা রকম এটা চিন্তা করা যায় কিনা, so that we can go to down to earth smallest models, সেটা একটা চিন্তা করে দেখতে পারি যে I think this is worth exploring. তো সেটা সেই পসিবিলিটির কথাটা বলার ছিল, এটা বললাম। আর হচ্ছে আজকে আপনারা আমাদের যে সময় দিয়েছেন এবং আমরা জেনেছি, আশা করছি যে আমাদের এই চিন্তা ভাবনাগুলো আমরা একভাবে শুরু করেছিলাম, সেখানে আপনারা এসেছিলেন, দেখেছেন। তো there are issues যেগুলিকে আমাদের আরো ডেভেলপ করতে হবে, ইম্প্রোভাইজ করতে হবে টু মেক ইট মোর এফেক্টিভ। তো সেই ক্ষেত্রে সেটা আমরা জাজ করব, এবং আমাদের মনে হয় এটাও একটা মানে ভালো সময় টু টু রিয়েলাইজ এবং টু রিফ্লেক্ট যে কাজগুলো হয়েছে সেখানে আমরা কোথায় কোথায় আরো ভালো করতে পারি, ইমপ্রুভ করতে পারি, সেটার একটা বিষয় আছে। তো সেটা আমরা দেখতে পারি, আশা করবো যে আমরা সেইভাবেই কাজ করব, জিনিসগুলো আমরা এগিয়ে রাখবো, সো দ্যাট when the new normal comes তখন আমরা যাতে ওটার উপরে চট করে আমরা কাজটা শুরু করতে পারি, আবার যেন বসে থাকতে না, সেটা আমরা চিন্তা করে রাখতে পারি। তো there are issues, questions, এগুলো আমাদেরকে আনসার গুলো খুঁজতে হবে। তো অনেক ধন্যবাদ। আমি এখন ডক্টর বিমল চৌধুরীকে অনুরোধ জানাচ্ছি ধন্যবাদ জ্ঞাপন করার জন্য।
Thank you, Mr. President Hasnain. Welcome and good evening to you all. Tonight, our program on Healthy Kids, Healthy Better Learners by PEDSI has been a great success, I think. We are very much grateful to have all of you with us. I express my heartfelt thanks to PTG Ahad Bhai and our Assistant Governor, Amresh Barua. And we learned many things about the PEDSI from Dr. Maqsood and Dr. Wasim and their teams, mainly Dr. Shamim and team of PEDSI, especially Sana, Samion, Rahan, Maison, and Fabian, and Mr. Jubai Hafiz. I express our thanks to them, and I especially give my thanks to Dr. Jean-Louis, who have joined from France. So we express our thanks to them also, and we express our thanks to Dr. Maureen and Mr. Rotarian Shamit Kumar Chaudhary and Jayanti Bodhi, and my BI Shurimal Chaudhary also give a look, but he did not attend thoroughly. Okay, and we express our thanks to our Hasan Bhai and all our members of Rotary Club of Cox's Bazar Shoykot. I express our thanks to all of you. At last but not least, I want to thank you all joining the Zoom meeting, and so thank you again. Cheers.
Thanks. Thank you.
Thank you.
Thank you. So
thank you, everyone. Great to meet you.
Thank you.
Yes.
Thank you.
Thank you.
All the best. Let's keep in touch.
Thank you.
Let's keep in touch.
Thank you.